Good afternoon, everyone. I hope you had a good weekend. It is November 23rd, and today we are providing another update with regards to COVID-19 in our community. We'll be joined by Dr. Gail Burstein to provide some updates on the health-related questions, and we're joined by Karen Gambino from Deaf Access Services to provide the American Sign Language. Just want to let everyone know that we had a very good conference call earlier today, myself with three of my county colleagues from across the United States. There were two Democrats, two Republicans on the call, in which we all highlighted the same message that this is not political, that the restrictions that are being taken across the country, not just in this region here, but across the country, are being done to save lives. There was myself, Commissioner Larry Johnson from DeKalb County, Georgia, County Executive Judge Gary Moore from Boone County, Kentucky, a Republican. Commissioner Johnson's a Democrat, and also Republican was County Executive Mark Molinaro from Dutchess County here in New York. And we just wanted people to understand that, in talking with the media, that this is an issue that is a public health crisis, and our response is in regards to a public health crisis. This is not about politics. This is about trying to save people's lives. And that's what we've been doing, and that's what we'll continue to do until such time as we're not talking about COVID-19 because we have a vaccine in place and a vast majority of the American citizens have taken it. So just to give you an update, case data summary. Through November 21st, there are 21,391 total positive cases, of which, of that 21,000, 37% of all cases for 2020 have been recorded this month alone in November, and we still have, of course, a little more than a week left. 771 individuals have died as of November 21st, and I certainly offer our deepest condolences to the loved ones and family members of those who've lost someone as a result of COVID-19. Unfortunately, more people have died in the last week. There were 273 individuals admitted to Western New York hospitals for COVID-19 on November 21st. That is higher than the highest point was earlier in the year in April. The earliest point was April 28th, in which we had 263 individuals hospitalized in Western New York hospitals. We are now above that and have been for the last couple of days' data. And we know Erie County has not hit its peak that we had earlier in the year. There were 226 individuals on that date that were in the hospital for COVID-19 from Erie County. It is the highest total that Western New York has had, and unfortunately we still have not reached the peak for Erie County, though we do anticipate hitting it soon enough. On the 21st, 40 Erie County patients were in the ICU, and 22 of them had an airway assist. The case report we just talked about, 21,291 cases. The daily positivity rate for the 21st was 6.8% with 392 cases. We had a 7-day positivity rate of 7.1, and there were 3,449 cases for just the week of November 21st alone. And our 3-day total for November is a little less than 8,000 with 7,819 cases. We have definitely seen the rapid growth, as I said last week. The second wave is here. It's here with a vengeance, and there are reasons we've taken the actions that we've taken to ensure that we're reducing the spread of coronavirus and saving lives. The Erie County hospitalization data chart for the 21st, we talked a little bit about this already with the individuals who are hospitalized, 226. 40% of all individuals were 64 and under, so this is not just older people who are in the hospital. Thankfully, on the 21st, there were no deaths, but as you can see from that bottom bar on the graph, there have been a number of days in which we've had multiple deaths. We thankfully have not seen a rapid increase in the ICU usage. That is huge. We've had multiple conversations in the last week and over the last few days with the hospital leaders who all agree that because of the better treatment options that are available, if people are going into the ICU, they're not staying there as long. And as was described to me in a conference call late last week with hospital CEOs, where previously the average stay was 8 to 10 days in the hospital in the spring, the average stay is being reduced to 5 to 7 days now. That makes a big difference, especially as it pertains to the ICU numbers. Though we are seeing a slight increase in the number of individuals who require an airway assist. I wanted to show you this chart. This is Erie County only. This goes back to the beginning in March. The high point for Erie County was 258 cases. And you see where we are now with 226, and you see the very rapid growth in the last 2 weeks. We are seeing the cases, as I said last week, shooting straight up through the roof. We have not yet reached the high for Erie County that we had earlier this year. I do believe the hospital systems are in a great position to add additional beds if necessary. The problem isn't the beds. The problem isn't the PPE. The problem is the staffing. This is why we all have to be better, because these individuals in the hospitals, these first responders, these healthcare heroes have been doing this for months now. And while they got a little break in the summer, they still have been dealing with COVID-19 patients in the summer. And here they are with the numbers shooting through the roof again. And we got to be able to keep down the caseload for the hospitals, if just for the healthcare heroes have been working so hard since March. We want to ensure that that blue line that is going straight up right now starts to level off and eventually drops. We don't think that'll be the case for the next couple of weeks at least. We're hopeful that we can stem the tide and reduce the hospitalization growth, especially with Thanksgiving coming and what could happen within 2 weeks after that. But let's keep this number down. I want to see that blue line going down, at least leveling off, rather than the continuing upward trend, which is not good. And then Erie County hospitalization data, a comparison of the 15th to 21st. Going back before the 15th, there's actually been a doubling of Erie County cases in 10 days, 104. Previously, about 10 days, it would have been November 12th probably, and November 21st, 226. So we're seeing a doubling in a 10-day period. The largest age range with patients now is 75 to 84. That was not the case when we talked about this last week. We had, of course, seen the 55 to 64 having the largest age range of patients. That has changed. This is just meaning that, of course, not only is the second wave here, but those who are more at risk for hospitalization and death are catching it, and we want to keep that number down because we know everyone is susceptible to catching COVID-19. Everyone can catch it. The odds of you getting sick and having a serious illness increase the older you get. But as you can see from this chart, on the 21st, there were 24 individuals in Erie County hospitals that were between the ages of 20 to 44. So just because you are younger doesn't mean you might not be hospitalized. And hospitalization is no fun. You do not want to be hospitalized for this. Diagnostic testing, I'm going to turn it over to the doctor to talk a little bit about this, about what we've seen, which of course is rapid growth in test results. We have, of course, done more testing in the last few weeks as we got more testing available across county-wide, which would not be surprising to see growth in the confirmed cases, but we are still worried about the growth with regards to the positivity rate. As of the last week, it was 7.2%. So it didn't shoot up at as rate as it had previously. That's important, but we know COVID-19 is out there because a lot of people are testing positive. So let me put my mask on and turn it over to Dr. Burstein.
Thank you. Good afternoon. So as our county executive mentioned, we're seeing an explosion of cases in the past 2 weeks. So actually, for this past week, we've seen 10 times as many cases as the week ending on October 17th, so compared to a month ago. And then the positivity rate this past week was 6 times higher than the week ending October 17th, which is what was about a month ago. So we've had really an explosion since the beginning of November. And the number of specimens that are being tested have also significantly increased. They've actually, nearly doubled this month compared to last month. So we've seen also not just an increase of number of people being testing positive, but also the proportion of people testing positive, and that's despite an increasing number of people who are tested in the first place. So we're seeing an explosion of cases in Erie County. So this is looking at the cases in the zip codes and the towns and villages in Erie County from from this past week, ending on the November 21st. And so we're looking not only on the total number of cases, which you can see in the middle column, but we're also looking at the rates of cases. So the number of new daily cases per 100,000 population on a 7-day average. So this is looking at the rates, which is really more indicative of the morbidity, of the penetration of disease in our population. So you can see that there are some areas of Erie County that have very, very high rates. A very high proportion of people in the county are in that area are infected. So, for example, in Hamburg, Lancaster, those are both over 80 new cases per 100,000 population per day. We're also seeing other areas like Cheektowaga, Eden. These are all very, very high, and we haven't seen these numbers, in a very long time. So this is a huge problem. What it means is that COVID-19 is out there. You can't assume that anybody that you're with, anybody that you're near, anybody that you're room with is not infected, because we're seeing so much infection in the county, and we just have to act appropriately to make sure that we can just start to bring these numbers down. So unfortunately, we're also seeing a rise in mortality, as our county executive alluded to. So far in November, and the month isn't even over yet, we've had 40 deaths. And the average age of, unfortunately, that people have died has also been increasing. It's now the average age of victims of COVID-19 deaths is age 77. So already in November, we've seen more than twice as many deaths as we've seen in September, and our month isn't even over yet. So this is also a very deadly infection. Even though many people have mild symptoms or no symptoms, this is taking its toll in terms of life among our Erie County residents. So we've had, as I mentioned, an explosion of cases in November. So since November 1st, we've had 7,819 positive test results among Erie County residents. And we really were overwhelmed at the health department. And recently, like over the weekend, we identified that there were actually 10 cases, people with positive COVID-19 test results that had an unacceptably long notification time. And it was over 7 days. And we have taken steps to ensure that those delays will not happen in the future. We figured out what the processes is that weren't working out as well as we hoped. Those processes were working really well when we had a smaller number of cases, and it was very easy for our contact tracers to talk to people, the day after they got their test results, to do a notification and case investigation. However, with this huge number that we're being overwhelmed, we have really had to figure out a different way to do things, and we have been successful. But even through this all, even through the large number of cases that we've been receiving into our contact tracers, still the average time from the time of the result, that we see the result, to the time that somebody is interviewed by one of our contact tracers, from people who are tested from our Erie County Public Health Lab, is still 3 days. So we're still trying to keep that tight. So just some, highlight some processes that we have changed to make sure that people get their test results who are tested by our public health lab in a timely fashion, and also that the case investigation is started in a timely fashion. So number one, we're going to make sure that Erie County staff will contact all patients with both a positive and a negative COVID-19 test results within 24 hours after we get that test result from eClares. So we are going to be, so people can expect that as within 24 hours from the health department receiving those test results, people with both a positive and a negative test result will be receiving a phone call to let them know if they tested positive or negative. If they test positive, the person on a phone will let them know that as long as, in addition to them testing positive, that they have to be in isolation, briefly explain what that means, tell them that a contact contact tracer is going to be calling them in the next day or so to find out, to complete the investigation and to find out who their close contacts are. So they should think about, getting a list together of who their close contacts may be. We're also going to be doing some quality control with our contact tracing, making sure that everything is working as we will have expected. So we take this very, very seriously. Although there were only 10 cases, 10 people, individuals out of the over 7,800 positive test results from November that had a delayed response, that is still unacceptable. And I want to personally apologize for that. The buck stops here, and we shouldn't have let that happen. And we are watching very closely now to ensure that that does not happen again. So we are continuing to test people in Erie County. We're testing people who are close contacts to confirmed cases. So those individuals should be under quarantine. Even if they have symptoms or they don't have symptoms, we're still going to test them. And then also we're going to be offering testing to people who do have symptoms who are residents of Erie County. So it's the same drill. Call our number, our hotline at 858-2929 to schedule. We have boosted the number of call takers, and we have extended the queue for our call taking, so you should be able to get through in a reasonable amount of time. So remember, this testing is free. You don't have to have insurance. You don't have to have a physician's order. You just need to have an appointment to get tested. So now I will turn it over to our county executive to talk about how we are responding in Erie County.
Thank you, Doctor. And I want to follow up on what the doctor noted about the 10 cases that we identified that were unacceptable timelines. The individuals were identified, but unfortunately it took a lot longer than it should have. I was not happy about it. As the doctor said, the buck stops here. Last week I said, no, of course not. There's no cases like that. Well, I was wrong. There were mistakes that were made, and it'll never happen again, or at least we've changed the protocols to ensure it won't happen again. We say that someone won't fall through the cracks when you're talking about thousands of cases in a very short period of time, but it shouldn't have happened. We apologize, and I've ordered the changing of the protocols to ensure that every individual who gets a test, once we have the receive the results, will get a call within 24 hours from the Erie County Department of Health. This applies to the tests through the Erie County Department of Health. We do not control the tests from other sources that we know can still take multiple days to receive results. So just want to say it shouldn't have happened. There were thousands of tests that were done during that period, and unfortunately it appears 10 had elongated dates from notification. It should not have happened and won't happen again. At least we're going to do our best to ensure it does never happen again. The microcluster strategy, orange and yellow zones, we talked a lot about this. I'm not going to spend a whole lot of time, other than the governor earlier today said we are trending to be in a red zone. And he put a number of places that had not been in yellow or orange zones into yellow and orange today, which surprised a lot of people. I've already been texting with some of the individuals from the other counties. They thought they were not going to have to worry about it till Wednesday, but they are very worried. If you saw the governor today, he's very worried, and well, he should be, because we're seeing a spike. And as he noted, the town of Lancaster has the highest infection rate on a weekly basis than any other community in New York State. Basically 9.7%. We have to do better. We do not want to go into a red zone. I don't talk about it in these slides here, but if you see it in this one, it talks about what is prohibited. All non-residential gatherings are prohibited. All residential gatherings are prohibited. Houses of worship are limited to 10 people. Non-essential businesses are closed. And there's a long, long list of non-essential businesses. Dining, takeout, delivery only. There's no outdoor dining at that point. In schools can test out, but it's very difficult. So we want to avoid the red zone. The governor said we are trending towards it, and he's not wrong, though I am glad to say we have seen a stabilization in the testing positivity rate. We are still seeing an increase in the number of individuals testing positive in some communities based on the population being 100,000 average. So It's good to see that the positivity rate seems to have leveled off around 7%, but remember, the level to go to red is 4% or above. So New York State could automatically put us in red. We have seen a leveling off, which is good. I hope the data that comes today, which will be for yesterday, will show either a leveling off or dropping. But if we saw big spikes in the near future, we could go red. We're trying to avoid it. These are the rules regarding orange. I think you all know what those rules are. We're not going to go into them in great detail because of everything we've dealt with, but we need to do our best to avoid the red. It is as close to a complete shutdown as we had earlier in the year, except some essential businesses like banks, some essential construction, but not all. Other types of businesses can stay open, but at extreme reductions, and we want to avoid that as much as possible. Back to business, I want to focus a little bit on some of the things that we've been doing and to give an announcement on what people should expect with regards to our grant program. But we have a great program in place, Back to Business, Shop Safe, Shop Smart, Shop Erie County. A lot of businesses are local businesses. You can shop online, you can get pickup, they'll curbside delivery, so you don't even have to walk into the establishment. But the grant program, which we talked about earlier, we haven't had a lot of discussion recently as we've been going through the applicants. It is a $20 million relief fund for small businesses, basically 50 or less employees. It's a sliding scale on the amount of money that the business could receive based on the employees. Our partner, 43 North, is in the final stage of application review process. We expect that starting next week, approximately 1,400 grants will be started to go out to local businesses starting next week. These are thousands of dollars that are needed for these businesses, some of which unfortunately now because of the orange zone had to close again. So we are expecting next week that we will announce the first recipients, which will be about 1,400 small businesses for our Erie County Back to Business Grant Program. I want to thank all of those in county government, the ECIDA, our partners at 43 North, our partners with some of the other organizations that played a role in getting this to be a reality. There was a tremendous demand for this $20 million. And we will start to see some of the first checks going out the door next week. Just to give you an idea, we did a buy local marketing campaign. It's still ongoing in print, digital, social media, billboard, bus shelter, TV ads. I've seen them myself. Streaming on the internet as well as radio. So far, there's been 22 million impressions. We've had a number of businesses contact us thanking us because they've had people who've come in and shopped or bought online as a result of the buy local marketing campaign. That will continue through the remainder of this year. We want people to shop at local establishments. Spend your money at a local establishment. If you spend your money in a local establishment, it'll keep people employed, and they will spend their money also here. So please, continue doing that. Here's just a few of the things that you might have seen online, the commercials, talking about our neighborhoods and where you could go shopping in neighborhoods or restaurants, and the Shop 716 Challenge. Of course, the gift card that we are offering. If you buy a $25 gift card you will or more, you'll receive a free gift card from Erie County. So the Shop 716 e-gift card, it's an electronic gift card. You don't have to go in the store. You can just buy it online. The recipient, if you send it out to a recipient, will get it immediately, and it can be used at any of the establishments online. We want people to shop. We want people to know that our local economy still needs to be supported. So please take advantage of the Shop 716 e-gift card. I bought my e-gift card last week. I got my free gift card, and now I got to figure out where I'm going to go shop. But I've got $50 worth after buying $25, so I got $50 worth when I'm going to shop at a local establishment and hopefully help them in the long run, and then also have a big impact on our economy if everybody went in and bought in this program. So once again, go to amherst.org/shop716 to buy your card online. If you're a small business and you'd like to participate, we've had hundreds already participate, but if you'd like to participate as a merchant, go to the same site, amherst.org/shop716, and click on merchant to be included as part of the program. And just before we finish, we want to talk a little bit about Thanksgiving. I talked last week about how there was a big spike after the Canadian Thanksgiving, and you can see it on the chart here. This was provided by the Canadian government. And you will see that their Thanksgiving was basically a month ago, a little more than a month ago in October, and then they started to see a big spike in cases thereafter. They have thankfully seen a little bit of drop, but as you may have heard, the city of Toronto, starting today, is on a 28-day lockdown. They are taking it seriously up in Toronto. Ontario Premier Doug Ford has shut down all of Toronto and some of the Peel region, 28-day shutdown in the hopes that they can continue to stem the tide. But they saw a big increase with Thanksgiving, and we want to do the same here, and that we don't want to, I should say, don't want to see the same here. We want people to take it seriously. Just have Thanksgiving with your immediate family and no one else. And so here's just some ideas that came up from the Department of Health. Hold a virtual Thanksgiving meal with your family members who may live elsewhere. Try a new recipe. I think that's Dr. Burstein's recommendation. Play board games with people in your household. Watch the Thanksgiving Day parades, which of course are going to be totally different than years past. Sports, movies at home. If you do an outdoor activity, do it with your immediate family. Stay away from others if you can avoid it. Do online shopping for Black Friday and Cyber Monday, and do it with a local company. Don't go into the crowds. I know some people are going to do it, but our Department of Health inspectors, we've already setting up a plan on how to address. So once again, we remind all the big box retailers, you would rather have people coming into your store at a limited rate buying than being shut down because we have to shut down because you've gone over your capacity requirements. And just even if you can, prepare a traditional dish and leave on your family's doorstep or porch that you might not see, but if you normally do a special type of sweet potato pie, you're not going to be with your parents this year. Looking at my brother Rob, you should send a nice little dish of sweet potato pie in this special super recipe that he has and leave it on the porch for my parents so that they can enjoy that tremendous delicacy that my brother does so well. With that, we just want to thank everybody for the good work that they've done, at least helping to level off the percentage positive rates. We are still seeing lots of cases in the community. There are some areas that are worse than others. We need to ensure that we are all in this together. We bring down the numbers. We do not want to go into the red zone. The red zone would be very bad. The shutdowns that we've had so far would seem minuscule compared to what the red zone would be. And it's possible that by Wednesday, if things don't get turned better, the state could shut us down. I'm having conversations all the time. It's been a number of conversations today with state officials, and they are worried. I look at it this way. The governor said what he said earlier today because he's serious, that we are trending in the wrong direction, and we need to find a way to get that down because we do not want to go into the red zone. With that, I'll open it up for questions. Let me just turn up the volume here, and we'll start with WKBW-TV, Madison Carter. Can you hear me, Madison?
Hi, Mark.
Hi.
I can hear you. Glad to see you made it out of this weekend, okay? I actually have a couple questions for Dr. Burstein, though.
Okay, let me turn it over to her.
Thank you. Dr. Burstein, we're talking about these new testing protocols. You said that people are going to get a call within 24 hours after you receive the results from the lab. But with all these delays, can you tell us about how long it's taking to get those results? And then secondly, all the guidance we've gotten from health officials are saying that asymptomatic people are really the most dangerous, not necessarily symptomatic people because they're already in quarantine. So how come the county continues to just test people who are symptomatic at this point?
Okay, so the first question is about time to test results. So for people who are tested by our Erie County Public Health Lab, so that's going through one of our Erie County drive-through clinics, usually the lab is able to turn them around in about 2 to 3 days, sometimes shorter. And so we will get the notification when those results are completed. They go onto eClares and we pull them off of eClares, and then we will assign staff to call both the people with the positive test results and the negative test results. The people that are getting tested through our rapid testing program are getting their results at the site of at the time they're getting tested. That's the nature of a rapid test. And then the people who are getting tested from an outside laboratory, a commercial laboratory, or from their healthcare providers, the ordering physician in New York State is legally responsible for giving those individuals their test results. So those individuals should be getting their test results from the physician or the office that ordered the test. And I don't have control over when those notifications take place. And so we're hoping that with the increasing number of contact tracers that we have on board, so for example, today we have 57 contact tracers working. We have 10 tracers that are in the middle of their training. This is in their second week of training. And we brought in 8 new tracers today that are starting their training. And next week we'll have a whole host of additional people working in contact tracing. So we are exponentially increase the number of contact tracers to go back to decreasing the amount of time it takes from the notification of their positive test result to the time that the investigation is started. However, you remember that the most important thing, the most important piece of information that our Erie County staff will be delivering is that, one, what your test result is, and 2, if your test result is positive, then you have to be in isolation. And we'll briefly explain what isolation is. We have a whole litany of information on about isolation and quarantine on our Erie County Health Department website. We have the FAQs and the isolation orders and links to CDC has a really good one-pager about how to safely isolate and then how to safely quarantine. And then I ask them to start to think about who their close contacts are. A lot of time it takes people like a day or so to kind of remember who that is, and hopefully by that time the case investigation will have started and we will have called those individuals. And then your second question was what, if you can remind me?
Yeah, all the guidance we've received from health officials, including your office, is saying
testing,
asymptomatic
right.
people are really our most dangerous people in the environment because they don't know they're carrying it. So how come Erie County continues to just test symptomatic individuals and then only their close contacts?
Well, who we are testing close contacts of positive cases, regardless of their symptoms. So many of those close contacts are asymptomatic who we're testing. So we are testing asymptomatic individuals. Symptomatic people are also very high risk. And there we see a higher proportion of positive tests oftentimes with symptomatic people compared to asymptomatic people. We know that something's causing their symptoms, and it could now in this time it could be COVID-19. So so asymptomatic people are dangerous because you don't know that they're infected. You can't look at them and tell. However, there are lots of places in Erie County where people can get tested, and we have that on our COVID-19 website at COVID-19 test sites. So that's that's something that people can do too. And I think our county executive wants to say a few words.
Thanks. I just want to note, Madison, we're getting unfortunately cases of individuals who are symptomatic that are still going out in the community, going to work after they've had a test. That's why we say you get a test, you have to isolate. But some folks are like, I have no choice. My employer's making me come in. So we want to test everybody who's symptomatic, and to the employers, you got to let people stay home. You cannot threaten to fire them because they're sick and they're waiting for a test result. But that's happening, and it's not good because then somebody has to make a determination. If I don't go to work, I may lose my job, I may lose my house, I might not be able to put food on the table, but if I go to work and I'm sick and I'm COVID, I could pass it on to other people. That's a decision that no individual should have to make because some employers are doing it. So we test symptomatic and we test asymptomatic individuals who are close contacts, and there's tens of thousands of other tests that are available in our county right now for individuals and sites to go. The county is just a very small amount of all tests. Channel 4, Chris Hravatis from WIVB.
Hey, Executive. Let's talk about what the governor said earlier today, the red zone. Do you have a meeting tomorrow with his staff to discuss a recommendation? What will your recommendation be? I'm wondering if we should be looking.
I lost you a little bit there, but I know it's all about the red zone and recommendations. We're actually getting data right now from our epidemiologists for the previous week, the breakdowns based on actual percentages per week. We just got the file from New York State on the most recent data, the stuff that the governor talked about. They don't always release it to us as early as they may do, or release it to the general public, or at least the high-level statistics. We're getting all low-level. Actually, I was flipping through my phone as Dr. Burstein was talking here, looking at some of the data that just came in from our epidemiologists. So we'll take a look at it once again and sit down with the state and try to figure out what is in the best interest. As I said, it's great that we've actually seen a leveling off on the positivity rates. Because remember, they were, and I'll go back a few slides here, they were continuing to go up on a weekly basis, almost doubling. And you see the 24th, the weekend of 24th, it was 1.3, then it was 2.4, 4.5, 6.9. Okay, the doubling stopped, but then it's down to 7.2. So it went up still, but it didn't go up as high at a rate of increase as we were seeing in the prior weeks. So that's a good sign. It's probably one of the only good signs we have out of all this info. So we're not seeing the rapid increase in infection rate that we were seeing earlier. So that means people are heeding the warnings, I think, and as a result, our community is slowing the transmission of it. It's still not good, but they are slowing the transmission, so it's not getting to the point where you're seeing in other states where the positivity rate is over 10. It's over 20. In some of the Great Plains states, it's over 30 and 40% of people testing are coming back positive. So that'll be all part of the consideration tomorrow. Is there anybody on from WGRZ TV?
Yeah, hi, Kelly Dudzik here. As far as a potential red zone, would it necessarily be the orange zone moving into a red zone, or could it be more targeted where you're just doing certain zip codes?
It could be all of that. It could be targeted. It could be the whole orange zone. I mean, we have to remember there's hundreds of thousands of people that live in this area. I don't even know if it will go to red at this point. As I say, with having a stabilization of the positivity rate, that's a good sign to show that maybe the orange zone restrictions are making a difference. So it's all part of the conversation. Everything is on the table. I just would leave it at that. Everybody wants to know the answer today. I had some people texting me today and calling saying, hey, what's it going to happen? And the answer is, I don't know yet. I'll know when we finish our conversations with the state, and then the governor will announce it. If it happens tomorrow, it's tomorrow. If it happens Wednesday, it's Wednesday. I don't think it'll happen on Thursday, being Thanksgiving, but I can tell you this. I'll be in the office, and so will be a whole bunch of people from the Erie County Department of Health and other departments on Thanksgiving working, because just because it's a holiday doesn't mean we're just going to sit at home and do nothing. There's work that needs to be done with regards to the COVID-19 crisis. Spectrum News, Ryan Whalen.
Hi, Mark. With regards to the incident between business owners and the Erie County Sheriff's and a sanitarian on Friday evening, the business owners asserted that the sheriff and the sanitarian had no right to be there because it was a private. I wonder if you could speak to that, on whether they were allowed to go in there and what their course of action was.
Well,
And just a follow-up question to that, we had calls today from some activists saying that sheriffs should no longer escort sanitarians on calls like this. Can you speak to what sort of risk that might put the sanitarian in if they didn't have a sheriff's escort?
Well, the sheriff should definitely be escorting. It's part of the enforcement mechanism. The governor mentioned it today. Law enforcement has a role. The sheriffs should be enforcing the law. It's as simple as that. And I'm glad the sheriff's office has worked with us to enforce the law. I just remind everybody that just because something's private property doesn't mean the government has a right or can't go in there. Almost every parcel of property in Western New York, unless it's owned by government, is private property. But our healthcare sanitarians, as well as others, have the right to go in and enforce the rules. This is a business that requires certificates from New York State to exist. The same thing with Erie County. And we do have a right to enforce the rules as it pertains to a business. This was not a private gathering of somebody having Thanksgiving dinner in their house. This, my understanding, was a fairly large gathering of individuals at a business in which they were talking about how they were going to avoid following the rules. But it's a business, and a business does fall under the auspices of New York State. If you're a corporation or a limited liability company, you have to file your papers either incorporating in New York State or somewhere else, and then to do business in New York State. And if New York State strips you of your papers, you can't do business in New York State. You will lose your insurance. I know this because I practiced law for a number of years, incorporating businesses, limited liability companies, even DBAs. DBAs still require a filing in the office at the Erie County Clerk's office. So I just want people to understand that there are private property rights that an individual has, but it'd be no different than if there was an active crime on the site. If there was an active crime on the site, we can't, having a business owner say, no, you cannot go on my premises because it's private property, doesn't fly. Police, EMTs, and the rest could go onto the site to stop an active crime. So I just want people to understand that the government has no interest in doing this, but we will enforce the rules, and we will continue to enforce the rules, and I thank the Sheriff's Office for supplying staff to do so. Buffalo News, Sandra Tan and Aaron Besker.
Hi, Mark. The state has just put out its latest numbers saying that the Western New York region has hit 300 hospitalizations as of yesterday. I was wondering whether it would be possible for us to get sometime later this afternoon updated numbers from Erie County regarding its hospital and ICU rates, just so we can have some comparative numbers to publish.
Sandra, if we get them in time, we'll publish them today, but sometimes we don't get them till 9, 10 o'clock at night.
Okay.
I
Well,
mean, that's why usually we don't release them until a daily basis. New York State will release them sooner, and we do not get the HERDS data, as it's called, which is the hospital reporting data, until usually the earliest we'll get it is around 5 or 6. Usually we get it around 9 or 10 o'clock at night, which at that point we usually wait until the morning to release our full data because it just makes sense. But it's not like we're holding back the stuff. The state does not send it to us often on a timely basis.
So in regard to this issue of hospitalization numbers and capacity, is there any more discussion about possibly revisiting the convention center as a field hospital, or any other concerns you have about the rising hospitalizations and capacity pressure?
Well, the concerns that were put to myself and Dr. Burstein were less about beds. They could add as many more beds in hospitals. The problem is staffing. So if we put 200 new beds at the convention center, right now, we question whether we'd have the staff to be able to handle those 200 new beds. We probably would have to have the National Guard bring in basically hospital units to mobilize and actually handle it. I think the putting together of the beds in the hospitals as well as a third-party site will be a lot easier than actually staffing it if need be. That is the concern that's been expressed by the hospitals, and as was told to us, if we put together and working with our partners like the Army Corps of Engineers, a COVID-19 only hospital at the convention center, they said that's great, but we would not be able to provide you staff to staff it because we need it for our own services. We'd probably have to call on the National Guard to mobilize entire hospital units to actually staff it. And right now, as you see, this is going on across the whole country. So I'm very concerned that there would be appropriate staffing even if we asked the National Guard for it. Next question, WBFO, FM 88.7. No one on? WBEN, Mike Baggerman, I believe, is on.
Hi, Mark. I'd like to ask about Erie County's COVID hotline. We've been getting some notifications from residents that it went unanswered over the weekend. Do you know why the COVID hotline wasn't working?
It was working. It was just getting annihilated with calls. Thousands of calls. It was working, but there's a certain point when if there's if we get a certain number of calls coming into the line, they will not go into the queue, so to speak. We've increased the number of calls that can go into the queue so that you have a waiting period. But my understanding is earlier today we may have already received about 1,500 calls just today alone. And the weekend was the same. It appears that a lot of people want to get tested. I fully understand that. We are also, once again, only testing a certain group of individuals in our community, those that were contact traced and our close contacts of individuals or those that are symptomatic. So if you don't have anybody that's symptomatic, we won't test you, but we've had people call that just say, hey, I want to get tested. Well, we recommend you go to another site. But we're getting slammed with calls to the 858-2929. We extended the call center times to the weekends as well as on the weeknights. So we have more time available. I guarantee you, the worst time to call is early Monday morning or in the mornings. It gets a little lighter in the evening, but there's a lot of people who are calling to get tested. Back up to the top, or first off, anybody else I did not call upon who may be online?
Yeah, hey, this is Aaron at the Buffalo News. I wanted to ask about your recommendations for if you go red. Can it work if you go, targeted by zip code or something like that, or does it really need to be broader based on the nature of the region?
Those are all discussions we'll have with the state based on what we see. It's pure hypothetical at this point. So it's all discussions we'll have with the state. Back to the top, Madison Carter, WKBW.
Mark, my colleague has a few follow-up questions to Ryan's inquiry about that gym protest. I guess the first question is, why were public health officials, sanitarians even there in the first place? Did somebody call that in to say that something was going to be happening? And then secondly, can you help us understand why this was different from other protests? A couple happened over the weekend. They weren't shut down. So what's the difference here?
My understanding is we received a tip that there was going to be a large gathering indoors. Now, that's always something different than what happens outdoors, like the protest in front of my house. It is outdoors, though I saw a lot of those folks were not wearing masks, and they were really at risk of potentially getting COVID-19. But we received a tip that there was going to be a large mass gathering of individuals at this location indoors, and it was sent on to the Department of Health, and the Department of Health contacted the Sheriff's Office, and they responded as they're trained to do. Chris Orvadas, Channel 4.
Yeah, just another one on the red zone, executive. Obviously, people are formulating their plans for what to do this weekend, and I'm talking about Black Friday and Small Business Saturday. Of course, a red zone would basically mean all the small businesses shut down, and I understand that you're urging people.
We're losing you, Chris.
Can you hear me? I'm sorry.
It's just you keep on going in and out.
I'll try to finish it briefly, quickly then. What kind of an impact do you think a red zone would have on the small businesses who are relying on Saturday, people in their stores?
Well, let's put it this way. There's a reason why I say we must not go into red zone, because it would decimate a lot of businesses. I know just from our sales tax revenue that the largest quarter on an annual basis for sales tax revenues for Erie County is the fourth quarter. We are in the middle of the fourth quarter. It is a big quarter because of shopping associated with the holidays. I would not want to have to guess what would happen to many small businesses if we were shut down for multiple weeks in November and December. It would be very bad. That's why we have to do our best to try to ensure that we keep the number down. It started last week, it starts again continues this week, continues on Thanksgiving. And if somebody's thinking about going shopping, I mean, there's so many ways to shop online with local businesses. There's so many ways to purchase things that you do not need to go in the stores anymore. It's not like the old days. When I, years ago, worked at Sears at the McKinley Mall, and they'd open up at 6 o'clock, and people would be lining up at 5 o'clock. You couldn't buy really online at that point. You wanted to come and get the rent set, the 10-piece rent set, you had to come in to buy it in the store, and people did that. So what I would just remind everybody is you don't need to do that anymore. And take advantage of our local businesses. If there's someone that has a thing that you want to purchase, call them up today and find out, will you have enough if I order it online, or if I come in and just do shopping later on Friday afternoon when it's not so busy? We want everyone to understand that if we do not reduce our numbers, the governor and his staff have put other regions in the red already. Just because we're larger, and this is Buffalo and Erie County, he's not going to say, no, I'm going to just let the pandemic continue and not take action. He has already put other regions of New York State in the red in the past. And I know from the conversations I've had with them, they're not adverse to doing it here if our numbers are bad enough. So we need to continue to do our best to ensure that we're not going in the red to keep our business up and going as much as possible. Kelly Dudzik, Channel 2, still on?
I am still here. I'm wondering if a contact tracer calls you, will they leave you a voicemail? Because I know a lot of people don't answer the phone if they don't know the number.
I believe they leave a voicemail. Yeah, the voicemail from Dr. Burstein's nodding her head from the Department of Health, noting that you need to call them immediately. So we will leave a voicemail. Spectrum News, Ryan Whalen.
Mark, one more on the gym. Obviously, we saw in the video the health inspector and the sheriff leaving the premises. Is there going to be any repercussion for the business? Has the county looked at fines or anything like that?
That is in the hands of others. It is not a decision that I make. What was really disappointing was seeing how our health inspector as well as the sheriffs were treated by those in attendance. My understanding is there's body cam video of that from the sheriffs. I haven't seen it myself, but I've heard that it showed a lot of angry and agitated individuals who were acting in a not so happy manner. I would just hope that people realize that our dedicated civil servants, whether they're sheriff's deputies or Erie County Department of Health sanitarians, are just doing their job. And they would much rather not have to go to a location like that, but they have laws to enforce. Buffalo News, any more questions?
Yes. You guys referred to the increase in the mortality rate for this past month. Would it be possible to get more detailed death demographic data for November as well as the overall deaths? I think there are a lot of folks who have questions about.
Yeah, I think we can do that. I mean, we usually get that data on Wednesday, to tell you the truth, from our Department of Health, but we went to a twice-a-week press conference schedule after the increase in the cases recently. So we normally would always have it for Thursday, but because of the timing issues, as you can imagine, they're working every day. It's not like they're getting days off. Our epidemiologists are doing their work on the weekends too. So we want people to understand it's not from a lack of work. It's just there is so much work that they're constantly involved in. And once we have that data, we can release the most recent mortality data.
Okay, thank you.
I got one too, Mark. What would you need to see, or what do you think would need to be shown before the decision is made for it not to go red here?
I don't know how many times you can ask the question, Aaron, but I just can't offer anything that's sort of a hypothetical. It could, it might not. We'll just take a look at the data and see. I mean,
what would the data need to show? I mean, the numbers already show basically that Erie County should be there. It's been above 4% for the state's threshold. So, I mean, what possibly could there even see that would make it not go red, I guess? I mean, the numbers are already
as
there.
I said, the one thing that we have seen is not the increase in the positivity rate. That has pretty much stayed static for the last week to 10 days. That's a good thing. But we might look at it and realize that there's some areas that are much more concerning than others. And I haven't even seen the weekly rates for each zip code yet. That we didn't have the test set data from New York State to be able to confirm that. So for me, it's still something that we haven't even looked at the data yet. Maybe New York State has, but we have not looked at it internally on a weekly basis to confirm exactly what the positivity rate is. So everything would be just hypothetical, and until such time as we actually have the data to look at and figure out are there particular problem areas or not, we'll go from there. But it's really based on the science, but primarily the data, which means if the area is horrible, then they'll probably go red. If it looks like there seems to be some sort of leveling off, or the actions that we're taking right now are doing a good job, well, then maybe they would not go red and they'd stay orange for the time being. I'd be shocked if the orange areas went to yellow. If there's one thing I can say, I doubt that the orange areas will go to yellow. I think they'd stay for at least another week. Mike Baggerman, last question.
Hi, Mark. I'm curious, and maybe Gail could answer this as well. For anybody who is habitually defying the gathering limits, say, these businesses that are protesting, Does anybody risk being arrested by either the sheriff's office or if the health department even has that capability? Does anybody risk getting arrested, or is it just fines that we're talking about here as punishments?
Well, it's fines, but I want to remind any business, they run the risk of losing their license. If they are a food establishment that serves food and they're saying, we're going to ignore this, we're going to serve to a full house without masks, the health department can shut you down immediately. If you are serving like a bar and you're above the capacity, the liquor authority can pull your license. And you can't sell a drop of alcohol at that point. So I would just remind all the business owners out there, including those who may not be happy with this, it's better to have to shut down for a couple weeks, maybe, than to be shut down permanently and lose your livelihood in the future. Because these actions will be in the record. So if the owner is of an establishment, Joe's Bar and Grill is Joe Smith, and we know who Joe Smith is, and Joe Smith gets shut down at Joe's Bar and Grill, and now Joe Smith decides they want to open Joe's Grill and Bar, we'll know it was Joe Smith. They're not going to be able to open up Joe's Grill and Bar. So I think it's important that all the business owners understand that fines are definitely a possibility, and the shutdown of your establishment permanently is as well, and we don't want to do that. Just follow the rules. I don't understand why some people here are so stubborn compared to other parts of the country who are dealing with the same thing. None of us want to deal with this. And I'm seeing in some of the other states that didn't have the mask requirements or the shutdowns of businesses, they're doing it now because they realize they should have done it a long time ago. This is all about saving people's lives. It's all about public health. It's not about power. It's not about control. It's not about politics. It's about saving people's lives. And I need everyone out there, Democrats, Republicans, Independents, to understand this is not political. This is about saving people's lives, coming together as Americans, regardless of your political affiliation, so that years from now, we can talk about how bad it was in 2020, but we got through it because we came together as Americans. And that's the spirit we need, especially as we enter Thanksgiving, that people realize that I know you want to be there with your family, but it's best if you're only there with your immediate family for your own sake as well as theirs. With that, this will be the end of our broadcast today. I want to thank Karen Gambino from Deaf Access Services for once again providing the sign language, Dr. Gail Burstein. We will not have an update on Thursday. We're figuring out if we do one on Wednesday or Friday, and it will also be dependent upon if there is a change in the cluster zone model, if it goes to red or not. But we'll give an update to media on that. I just wanted to remind everybody, be safe, be well out there, wear your masks when you go out in public, try to limit your activity in public as much as possible, avoid the mass gatherings. Certainly are the keys to what we're seeing in the continued spread of the coronavirus. And if we do that, we'll be all better for it and work together for a better future for all. Take care, everyone. If I don't talk to you beforehand, happy Thanksgiving.
Thanks for using WebEx. Visit our website